Tuberculin test, skin test. This is a test that is used for screening for TB, latent TB, or TB infection. So we're going to talk more about it so that you can understand. So this test, as we have said, this is prior, or we test prior for TB infection. They include TST and interferon gamma release assay. These are the two tests that we use to test for TB infection. So what are the basis of this test? The basis of this test, they just check immune sensitivity, and the immune sensitivity. This is the type 4 delayed, type 4 or delayed type hypersensitivity to the microbacterium protein antigen that might have occur following exposure and infection by mycobacterium. So I just to remind you that how many types of hypersensitivities are there. There are 4 types of hypersensitivities: type 1, type 2, type 3, and type 4. Just to remind you, type 1 is IgE mediated. Type 2 is cytotoxic, that is IgG and IgM. Type 3 is immune complexes. And then now we have type 4, which is cell mediated immune. TST, so what does it consist? It consists intradermal injection of tuberculin material, which stimulates now the delayed type hypersensitive, that is type 4 response. As you have said, it is cell mediated by T lymphocytes, and in patients with prior mycobacteria exposure, it causes an induration at the injection site 48 to 72 hours after the test. So how do we administer the test? Or administration of the test, you get 0.1 ml to 5 of the purified protein derivative solution. You inject it intradermally. Intradermally, how many, or when you inject it, at what angle? That is 5 to 15 angle the injection. You use a 27 gauge needle, and then it produces a 6 to 10 mm in diameter wheel. This is what we're talking about. Okay, so how do we read? This is very important how you read it, and as you have said before, you read it within 48 to 72 hours. You measure the duration, not the erythema. This is just a very good image on how just to indicate. So this is the induration, and now this is the erythema. So if you measure from here to here, you'll have measured the incorrect, that is the erythema. However, if you measure from here to here, this is the correct measurement, that is the induration. So positive reactions can be accurately measured up to 7 days. However, negative reaction can be read accurately only after 72 hours. So how do we interpret? So the interpretation is based on the risk factors, or is based on this individual that we are actually screening. Does this individual have risk factors for TB, or is this individual healthy? So risk factors for TB, example, patients who are HIV positive, patients who are on drugs that are immunosuppressive, etc. So a 5 mm in duration is positive in the following patients: patients who are HIV infected, patients who are in close contact with an HIV infected TB case, patients who have a chest X-ray finding consistent with prior untreated TB, patients who are in organ transplants. Patients who are in organ transplant, they're obvious, they are in medications that are immunosuppressive in order to avoid the rejections of the organs, and patients who are immunosuppressed. So patients who are in prednisolone, and patients who are taking TNF alpha antagonists. So the reason why 5 mm is because this lower threshold is significant in order for us to get these individuals who are at a higher risk of getting TB infection or TB disease. So the increased sensitivity at this cutoff helps us to know those who are at increased risk. So 10 millimeter in duration is positive in patients who are now intermediate risk factors for TB. These are recent immigrants within the last 5 years from a high prevalence country, or TB injection drug users, patients with other high medical conditions, obvious medical conditions. They have to lower the immune system, residents or employees of a high risk congregate settings, microbacterial laboratory personnel, and children who are less than 5, or let's say 5 rather than 4, These are infants, children, adolescents exposed are at a higher risk. So if it is 10, then it's positive. Next, it's 15 millimeter in duration. It's positive in patients who have no risk factors for TB. Now, the previous mentions are the risk factors of TB. So, what are the advanced effects of this test? You can get urticaria, dyspnea, and joint edema. So, this manifestation actually occur immediately within 15 minutes or within 6 to 12 hours after administration of the TST. So, adverse reaction should not be confused with or interpreted as positive TST. Management now of your now you have interpreted your TST or maybe IGRA, and now you want to now know what to do next. So when a person gets infected, I want you to actually clearly understand this diagram. The immune system can either clear the infection, or the immune system fails to contain the infection and you get active TB, or your immune system actually controls the infection, and this is what is called latent TB infection, which later maybe can be reactivated and goes back to TB infection. And the reactivation from controlled to TB infection, TB disease, sorry, is mostly in patients who are HIV and immunocompromised. So TST and IGRA tests, they test the delayed immune response or hypersensitivity response of the human body. So if they are positive, then it's likely that this patient, as you have mentioned in the previous slide, it's likely that this patient has TB, latent TB infection. What you do next, you exclude the probability of this patient having active TB, and you exclude by doing a chest X-ray. If the chest X-ray is normal, then our patient has TB infection or latent TB infection. However, if our chest X-ray is abnormal, it is highly likelihood that our patient has active TB. So what do you do next? You work up for TB disease. Understood. Next, if IGRA or TST is negative and the exposure of this patient is less than 8 to 10 weeks, then you do the following. You assess this patient as an individual. Is this patient immunocompromised or is it immunocompetent? Immunocompromised is just not only HIV, but we have other types, drug-induced immunocompromised. We have where you have defective or T cell, B cell, all those immunocompromised. So if our patient is immunocompetent and they are greater than 5 years, and our TST and IGRA is negative, then you don't treat. Understood? If our patient is immunocompromised and and greater than 5 years, then you start treatment for latent TB until you repeat the TST and IGRA 8 weeks to 10 weeks following exposure. Reason behind is that this delayed immune response develops 3 to 8 weeks after the exposure. So for immunocompromised patients who are at a higher risk of moving from latent TB to active TB, we just start treatment. After you have repeated your TST and IGRA after 8 to 10 weeks, and it is positive, then you do a chest X-ray. After you do a chest X-ray, what do you do? If it's normal, then the chest X-ray is we are at latent TB, meaning it is control. If it's abnormal, highly likely that we are in active TB. I hope you have understood. However, in patients who are HIV, consider completing this treatment of latent TB. If our patient is negative IGRA and TST IGRA, and the exposure is 8 to 10 weeks, meaning if they were exposed, for example, if there was infection, the delayed immunity response would have now been present, and they are negative, you don't do anything and you don't treat and you don't do further evaluation. I hope you have understood that point. Next, so false positive. False positive is if you have an antuberculous mycobacterial infection or you have BCG vaccination. Most countries, especially the countries which TB is endemic, they normally have BCG infection. So in patients, TST reactivity caused by BCG sensitivity can be distinguished from TB infection by IGRA test. So next, so repeat and serial testing. So the general principle is that once an TST is positive, it will always be positive for the rest of your life. So there is no utility in repeating a positive TST. I hope that's understood. Next test is repeating. Repeat testing. We have said we repeat TST for patients who are negative, who the exposure is less than 8 to 10 weeks. Understood? So that we can give the immune if so that we can give the immunity time for it to develop now the response. So interpretation, we say TST conversion is defined after now you have repeated a TST and the duration measures greater than 10 millimeter or it has increased by greater than 6 millimeter. Serial testing is done for patients or individuals who are ongoing who have ongoing potential exposure. I hope you have understood. Thank you.